My name is Veronica Click, and I'm a registered dietitian nutritionist here at Baptist Health Weight and Nutrition Center. What kind of made me want to be a dietitian is nutrition is just where I found like I can plug into patients the best and really make a difference in their life. I really love and I thrive on like individualized conversation. So I love our one-on-one appointment. It's our first appointment here. It's about an hour and a half long, but I really do a deep dive in kind of their medical history, their nutrition history, what their goals are, what my goals are for them. And I love doing kind of that one-on-one part with them. A dietitian is just someone who has studied nutrition. We have to do a bachelor's degree as well as a master's degree in nutrition now, and we do an internship as well. And during that internship, every 2 weeks, you're kind of changing your environment. So I've done a lot of weight loss in the past, but I've also done, clinical inpatient, out in the community with the food bank. There's a lot of things that a dietitian can do and plug into. The weight loss center is just one of those pieces. From Orlando, Florida, and I was in Oklahoma. Happy to be here in Little Rock for sure. But Baptist was kind of the biggest, most kind of well-renowned hospital that I saw here. So I just knew I wanted to be part of something that was well-established. My path to dietetics was not traditional at all. I thought I wanted to be a lawyer, thought I wanted to do all these things. And I really didn't know what I wanted to do. But I sat down and kind of figured out that dietetics was definitely for me, again, with kind of the health piece of it was really important to me. So I've been interested, we have a lot of education, so this is probably my 7th year of, studying nutrition in general. I think something that I've learned from my patients in particular is, it can be really hard to start a habit. And I try, whatever recommendation that I give a patient, I make sure that I try it out myself. If I want someone to add in spinach to their smoothie, I'm gonna do that. If there's just certain things that I want them to start, I want to make sure that it's realistic for them to do. And so I myself have started, different habits to see, how successful can you be sticking to something. And something that really helps patients be successful in their goals is the accountability that we can provide here. And every week it's hard to do something on your own. It's hard to do a habit totally on your own island, but we're all here, supporting you, cheering you on, to drink that 64 ounces of water a day. Like, we're so happy for you. What I've learned is it's hard to start habits, and we try our best not to just give crazy recommendations, that aren't realistic to people's lives, and something that they can do. So kind of at my first appointment too, I set up like, okay, these are our, goals in the future. This is what we want to attain. But I set up small goals week to week so that patients can meet those goals and get motivated that, hey, I can do this. I can, do one habit one time a day, and then they can build from that. So I think that's something good about our program too, is we're not just, giving you the tools and sending you off. We're here for you to support you through, each of those steps. I think a lot of times with weight loss, it has a lot of negative implications around it. Again, people are really just focused on that number on the scale. And I just really want to communicate that you're worth more than that number on the scale. That's never going to bring you happiness. You're going to bring you happiness with your healthy habits and things. And, this program is really about sustainable and healthy weight loss. So once you get off our program, hopefully you don't gain all that weight back. That's what I think is different about our program as well. As soon as people get off the other programs that are just like, shakes all day long, they're gonna gain back that weight because you can't eat shakes for the rest of your life, So we try to make sure you have real food options and kind of incorporate those into kind of your plan and everything to make sure it's sustainable. So I just want to emphasize that this is like a healthy, safe way to lose weight. It's nothing crazy. It's nothing sensational. Like, I'm not telling people you can lose 20 pounds in 2 weeks. Like, I would never say that. It's definitely the slow, healthy, sustainable weight loss that kind of your body can catch up to and that you can feel good about keeping off.